Anyone who looks at a COVID map knows Michigan is unquestionably a national hotspot right now. My team and I have been in regular conversation with the National COVID Response Team, and we have asked for more vaccines.
Michigan Governor Gretchen Whitmer there asking all residents to remain vigilant as the state's COVID-19 numbers increase rapidly. The state's new wave of COVID-19 cases is actually pushing hospitals there to their limits. While Michigan pushes for extra vaccines to be delivered to the state, CDC Director Rochelle Walensky is recommending another solution to hopefully flatten the curve.
When you have an acute situation, extraordinary number of cases like we have in Michigan, the answer is not necessarily to give vaccine. In fact, we know that the vaccine will have a delayed response. The answer to that is to really close things down, to go back to our basics, to go back to where we were last spring, last summer, and to shut things down, to flatten the curve.
So let's bring in Lydia Mobley. She's a Fastaff travel ICU nurse who's currently on assignment in Michigan. Hi, Lydia. How you doing? How are you doing right now?
I just got my negative results back today, and I'm very thankful for that because it was very stressful. I'm fully vaccinated, but just because of the amount of cases here and just because, again, unfortunately, the vaccines are not 100% effective. So just to protect those around me, because I was exposed, I did get tested just out of an abundance of caution, just because, again, I want to protect those around me and I don't want to be spreading it. So I got a PCR test and quarantined for, the 2 days until I got my results. And again, they're negative, but there are just so many people here in Michigan who have it, many people that I love and know. And it was scary. It was scary and stressful during those 2 days.
Why do you think we are seeing a sudden spike again in Michigan right now?
In Michigan, I think it's a number of factors. Unfortunately, we still have many people who, for whatever reason, are choosing to believe misinformation put out there on Facebook and not listening to, our country's doctors and scientists about wearing masks and social distancing. I think people are letting their guard down. Also, we do have a mask mandate, but it's not enforced here in our state, which is sad and scary, I think. Also, people say, well, Texas and Florida are wide open. Yes, but they have warmer weather. I don't know if many are familiar with the weather in Michigan, but today here, yes, it's April 15th, but it was only about 43 degrees here today, and they're calling maybe for snow later. So, yes, Texas and Florida and other warmer states are more open, but those people are being outside. And unfortunately in Michigan, the weather's still quite cold most days. So people are gathering and they're gathering inside. And as we know, when you're inside in close quarters with other people, that's when COVID is more likely to spread.
And, Lydia, let's be honest. I mean, many people in Michigan, not only Michigan, around the entire country, they look at lockdowns as an attack on their personal liberties. They want to see their friends. They want to hug their family members. And I'm curious, as an ICU nurse yourself, are there things that you've seen, that you've experienced to suggest that social distancing measures are worth giving up your personal freedoms?
I've watched a lot of goodbyes on Zoom between family members and their loved one who was on a ventilator before we withdrew care and they were not able to be at the bedside. And I think if many of these people just had to watch one of those, or if they had to be the one holding the iPad, I think they would be more likely to put on a mask and social distance. I have to believe that if they would take a second and think about, whether you believe that deaths are underreported, overreported, whatever you want to believe, the fact of the matter is hundreds of thousands of people in the U.S. alone have died, and closing in on 3 million people around the world. So I chose to get tested again to protect those around me. And I wear a mask to protect those around me, as those around me wear their masks to protect me. So I think right now, it's, you talk about freedoms, but right now the American thing to do is to wear a mask and get vaccinated to protect everyone around you, those you love and know, and more than just America. We're all in this together as the whole world. But the only way through this pandemic is to go through it together. And again, that's everyone doing their part, everyone wearing masks, everyone social distancing, everyone getting vaccinated. That's the only way we'll get out of this.
Having to be the person who holds the iPad, you said that you've seen so many goodbyes. How has that affected you as a person? How has it changed you as a person?
For a long time, I just tried not to think about it, because as soon as that person passes away, there's a new person coming into the room. Some shifts, when it was really bad in the winter and we're approaching these numbers again now, we'd have 3 people dead of COVID in just the first 4 hours of a shift, and that was just, a normal night. And this went on for weeks at a time, and it was going down. But now, again, people are letting down their guard. And here in Michigan, it's rising quite rapidly. I think our rolling 7-day average right now is like over 7,800 new cases every day. 18% of our tests right now are coming back positive. And unfortunately, the demographic is shifting to younger people because of a lot of the elderly have died. But our hospitals are quickly filling. I think last I checked, we have like over 24 hospitals in this state that are at greater than 90% capacity. They're talking about, bringing patients out on the lawn in tents. A lot of hospitals already have military grade triage tents for their ERs, and those are in use. Things are just so bad, and I don't know what it takes anymore for people to wake up and realize how serious this is. And just because you don't see it affecting you today doesn't mean it's not going to affect you or someone you love tomorrow. Because I think right now, and this is again last I checked, 18% of hospital beds are taken by COVID patients. And, as studies have shown so far, that the higher occupancy in an ICU, it's associated with higher mortality, because again, there just aren't enough nurses, or nurses can't give the care that they would be able to give if there weren't so many patients. And again, you may not think this affects you today, but tomorrow you or your loved one could be in the ICU. And so again, just wearing that mask today, or just not going to a party, or these small measures are really just the right thing to do right now to protect yourself and those around you.
Right. And you mentioned something very important. You talked about how, although you're vaccinated, you still got tested just out of an abundance of caution. I was reading just the other day about these breakthrough cases. People are still getting COVID, even though they're fully vaccinated, albeit a small number of people. But I think you're right. We should look at a vaccination as just another layer of protection, not, hey, this thing's over, we can do whatever we want now. Lydia Mobley, thank you. Thank you so much for coming on the show. I really appreciate all the work that you're doing. I'm sure a lot of people out there listening to your story, they do too. Thank you.
Thank you for having me.
All right, now let's take a look at a few other big coronavirus stories that happened on Thursday. The scientists leading the nation's COVID-19 response were on Capitol Hill today to tell lawmakers that vaccinations are the key to ending the pandemic. The heads of the CDC and the Department of Health and Human Services testified alongside Dr. Anthony Fauci. Dr. Fauci had a heated exchange with Ohio Republican Jim Jordan, voices raised at times as they went back and forth when the congressman asked for a date on when, as he put it, Americans can get their freedoms back.
You're indicating liberty and freedom. I look at it as a public health measure to prevent people from dying and going to the hospital.
You don't think Americans' liberties have been threatened the last year, Dr. Fauci? They've been assaulted. Their liberties have.
I don't look at this as a liberty thing, Congressman Jordan.
Well, that's obvious.
As a public health thing.
But
I disagree with you on that.
You think the Constitution is suspended during a virus, during a pandemic? It's certainly not.
This will end